Hi, this is a continuation of our series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care will be obtained. Hepatitis B. Hepatitis B is a liver infection caused by the hepatitis B virus. Hepatitis B is transmitted by blood, semen, or another body fluid from a person infected with the hepatitis B virus when it enters the body of someone who is not infected. This can happen through sexual contact, sharing needles and syringes, or from a mother to a baby at birth. Hepatitis B can be an acute or short-term illness, but it can be a chronic illness also. The risk for chronic infection is related to a patient's age when that patient is infected. About 90% of infected infants become chronically infected. That's right, 90% of infected infants become chronically infected. Only 2 to 6% of adults become chronically infected. Chronic hepatitis B can lead to serious health issues. Cirrhosis or liver cancer. Cirrhosis is the late stage of scarring of the liver. When scarring occurs, it may compromise the ability of the liver to function. The liver's main job is to filter the blood coming from the digestive tract before passing it on to the rest of the body. So if the liver cannot filter the blood, then many impurities in the blood will not be taken out. The liver also makes proteins important for blood clotting and other functions. Most persons with chronic hepatitis B virus infection are asymptomatic and have no evidence or outward evidence of liver disease. So the best way to prevent hepatitis B is by getting vaccinated. Makes sense to me. Again, it is transmitted by blood, sexual transmission, perinatal spread, and by close contact with infected family members. Perinatal spread is when a mother with the hepatitis B virus passes the virus to her infant during pregnancy, labor and delivery, or breastfeeding. Hepatitis B virus is not spread through food or water, sharing eating utensils, hugging, kissing, hand-holding, coughing, or sneezing. Now, what are the signs and symptoms associated with the hepatitis B virus infection? Newly acquired acute hepatitis B virus infections only cause symptoms some of the time. The presence of signs and symptoms varies by age. Most children under 5 years of age and newly infected immunosuppressed adults are generally asymptomatic. But about 30 to 50% of persons aged greater than 5 years of age have signs and symptoms. These signs and symptoms of acute hepatitis B virus infections can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice. Jaundice is a condition in which the skin, whites of the eyes, mucous membranes turn yellow. Here is the discoloration of the eyes. Here is the discoloration of the skin. Now, the incubation period for hepatitis B is about 90 days. It can range from 60 to 150 days after exposure to the virus. For acute infection, no medications are available. Treatment is supportive. There are several antiviral medications for persons with chronic infection. Persons with chronic infection require regular monitoring in order to prevent liver damage or lessen liver damage and or prevent liver cancer. Now, recommendations are that the following people receive hepatitis B vaccination. All infants, unvaccinated children aged greater than 19 years of age, people at risk for infection by sexual exposure, sex partners of hepatitis B positive persons, sexually active people who are not in a long-term monogamous relationship, people seeking evaluation or treatment for a sexually transmitted disease, men who have sex with men, and people who are at risk for percutaneous or mucosal exposure to blood, such as doctors, nurses, and other health workers. Now, there are 3 single antigen vaccines and 3 combination vaccines available in the United States currently. So there's no reason that an individual should not be vaccinated. The vaccination schedule most often used for children and adults is 3 intramuscular injections. The second and third dose is administered at 1 and 6 months after the first dose. Alternative schedules have been approved for certain vaccines in our populations. There are new formulations out that are approved for 2 doses 1 month apart. Discuss this with your physician to determine which series of vaccine shots are appropriate for you. Well, I hope this helps. Have a good day.